As we all know that we are having a series of session on pediatric cardiological issues. Today we are here in communication with Dr. Dinesh Mittal, Director Pediatric Cardiology and CTBS. And I am Neha, Manager Patient Advisory from Medigence. Here we go. Hello, sir.
Hello.
So here we are again with an interactive session having brief knowledge about pediatric defect, childbirth.
Yes.
So there are kind of defects which are, at the time of birth only. Defected, you're kind of having birth hole in the heart, or maybe we call it ASD and VSD closure sometimes. So we would like to understand what it is and how things are with these things.
Okay. So in the previous sessions, we talk in detail about what are the congenital heart defects and how we are going to treat them, like in the cath lab or in the OR, and how we do it. So now today onwards, we are starting a session with the specific diseases. So I think today we will discuss about the most common left to right shunt. Left to right
Um,
shunt means these are the diseases in which patient is having more flow in the lungs. Okay, so they are having hole in the heart at some level, on the different levels, and based on that level, they are known as either atrial septal defect or ventricular septal defect or patent ductus arteriosus. Okay? So we are going to talk about three most common congenital heart defect today. Okay. So I'm going to start with the most common defect, that is patent ductus arteriosus. And that defect because the baby kid survived in utero in the mother's womb. Based on that, that is present in all the babies when babies are in utero, in mother's abdomen, in mother's uterus. Baby is getting oxygen through patent ductus arteriosus. They are getting feed through the mother from patent ductus arteriosus. So this patent ductus arteriosus is present in all the babies. So in some of the babies, these patent ductus arteriosus is continued to be patent. Otherwise, in most of the babies, that get closed after some time after the birth. In these babies, this disease is known as patent ductus arteriosus. Right? So anatomically, this is a communication between the aorta. Aorta is one artery that supplies blood to the whole body, good blood, oxygenated blood, and between the pulmonary arteries. Pulmonary arteries is giving supply to the lung and pulmonary artery. So in the lungs, it means lungs are getting flooded. So that is patent.
all right, sir.
I think I am able to explain that.
Yes, sir. We are totally having a better conversation, and we know like what are these defects known as. So we want to know what are the specific, like, do we have any specific reasons why such kind of, what we call it, these kind of defects arise, or anything like, is there anything
So
which
like
defines the reason to these?
yeah. So I think everybody wants to know why these defects occurs and how to prevent these defects. Definitely, this is the
Right.
most important questions. The problem is we are not sure why these defects occurs in some of the babies. Okay, why patent ductus arteriosus is present in some of the babies, otherwise being closed in most of the babies. We are not sure about these reasons. Even genetic defects, we are not able to connect. Only in 5 to 10% of the babies we found some genetic abnormality in the heart. in which they have got multiple congenital heart defects. Otherwise, in most of the babies, we are not able to connect them of any of the mother illness, in any of the mother defects, or in any of the problem during birth. They are not related to any of the problem. So these defects are idiopathic. We don't know the reason about that, and because of that, we
Okay.
can't prevent them. Yeah.
Okay. So as I was saying, like since technology, we have advanced technologies. Many part of the countries or many part of the world don't have those advanced technology to detect these kind of defects before birth or at time of childbirth. So
Yeah.
what are the ideal symptoms? Like sometimes we miss the defects, sometimes we miss the symptoms, and the child is born and he's absolutely okay at that time, okay-ish maybe we can say, but later on sometimes it is identified after 2 or 3 years, or maybe when the child starts walking or doing physical activities. So what are the major, like what can be the symptoms on which we can identify these kind of defects and the procedures?
So most of the we are talking about these three diseases, and they are all left to right shunts, and they are having the high pulmonary blood flow. So mostly these three have got common symptoms. Okay. So commonest symptom is child is having repeated chest infections. Okay. We can say
Mm-hmm.
in the general language pneumonia. Child is
Okay.
having repeated pneumonia. Number one.
Right.
Number two, child is having failure to thrive, failure to gain weight. Okay. So very specifically, these mother tell you that history. Child is not able to suck. He is getting tired. He is getting early fatigue. Okay, he
Mm-hmm.
leaves that sucking in between. Okay, that is very common. Number two, they tell us he or she is taking breathing very fast. Okay, that is very common. They are taking breath very fast. They are restless. Okay, that is another symptom. And the third symptom, if child is big enough, not the small kids, they can't tell you ki what are the symptoms. If child
Mm-hmm.
is big enough, so then they can tell you ki while while playing they get tired. Okay, so these are
Okay.
the most common symptoms they are showing. Although like patent ductus arteriosus, these are the patient they develop symptoms very early in the life. Okay,
Mm-hmm.
maybe at the 1 month, 2 month, or 3 month, they will develop the symptom. The second disease is ventricular septal defect. They developed, these child developed symptoms little later, maybe after 3 months of age. They develop the
Okay.
same symptom, although failure to gain weight, and they are also having repeated chest infections, but little late. ASD is one disease, atrial septal defect. These patients tend to get symptoms very late, and most of the these patients they tend to diagnose at as an incidental finding, like they have gone to doctor for some other diseases and doctor diagnosed them. Otherwise, they don't have any symptoms related to that whole. Okay.
Okay. And as we understood from your discussions, and that ASD is diagnosed a little late, maybe sometimes, when you go to a doctor for some any other thing, for any other purpose, and they diagnose you and they come to you saying that you have this kind of heart
Most of
problem.
the time.
So what are, like, how risky is it to be unaware of, having an ASD? I mean, like VSD
Right.
and PDAs can be detected early in childhood, and we
Yes.
might have an option to treat them accordingly. But when it comes to ASD, I mean, how risky it is to be unaware of having a disease like this?
Yeah. So, symptom is one thing. Otherwise, there are some complications that is related to having an ASD. Okay. So, these are the patient. They tend to develop the high pressures in their lung. That is known as pulmonary hypertension. Okay. So,
Okay.
although with the ASD, in relation with ASD, that tend to develop little later. Okay. Maybe after 10 years or 15 years, they started developing that pulmonary arterial hypertension. Depends on size also. If it is of very large size, they tend to develop little early the pulmonary arterial hypertension. That is one
Mhm.
issue. That is one problem they are having. One complication they are having. Another complication, there are some of the patients they feel palpitation. Why palpitation? Because they tend to have some arrhythmia, the problem with the
Mhm.
abnormal heartbeat. Okay,
Heartbeat. Yeah.
so that can be diagnosed if we feel the pulse. That is number one. Or patient is telling you that patient is feeling palpitations, or else while doing routine checkup, we do one ECG. So we can diagnose based on that. That is also related with atrial septal defects. Okay, so these are two
All right.
complications: pulmonary arterial hypertension and arrhythmias. Yeah.
Right. And once we have diagnosed the situation, once we are aware that somebody is having ASD, VSD, or PDA, I mean, like, let's talk about ASD first. Like, for example, somebody is diagnosed with ASD, and at an age of maybe 12 or 15. Well, like, as you said, that ASD is diagnosed a little late. Maybe it can be diagnosed when we are adult, we are over 20.
Yeah.
It can be
Yes,
that case
certainly.
also.
A lot of time. Yeah, a lot of time.
Okay, so
So
how do we cope up with this situation? Like, what can be the ideal line of treatment, or maybe the prerequest that we can follow up to have understanding that if we are not having anything like that,
okay. So number one, the symptoms are important. Okay. I
right?
don't think if you don't have any symptom, you can do anything about it. Okay. Because there is
So
no recommendation.
ideal symptoms can be as you said that it can be arrhythmia, it can be palpitation, breathlessness, maybe.
Yeah,
Okay.
certainly. So if somebody is complaining the breathlessness, palpitation, or chest pain, okay. So the question was, ki you want to know what should we do if we want to diagnose it early. Okay.
Right.
So I don't think without symptoms we can do anything to diagnose that.
Mm-hmm.
Once you have got symptoms like breathlessness on exertion, like suspicion, atypical chest pain, or palpitation or something like that, definitely you should contact a nearby doctor. He will examine you. If somebody has got suspicion like, he will suggest the scan like echocardiogram. Based on that, we will decide what to do
Mm-hmm.
next. Yeah.
Okay. And what are the ideal treatment plans once defects are diagnosed, once we know that this patient is having a ASD or VSD thing or PDA, we have identified the cause of his problem. Why he or she is having kind
Yeah.
of palpitations or chest pains or breathlessness, maybe tiring very soon. Once we have diagnosed the cause, what can be the ideal line of treatment for these defects and problems?
So we will all three diseases one by one. The first one
Mhm.
is patent ductus arteriosus or PDA. So once you've been diagnosed, yeah, once we are being diagnosed with the PDA, so that treatment depends on the size of PDA and the age of the patient and the symptom of the patient. If patient is symptomatic, we have medical management, and once we are sure that it is not going to close with the medicine, then definitely we have to decide, although between the device or surgical treatment. If child is very small, we will go for the surgical closure. And if child is good enough, size is okay, weight is okay, we can do the device closure. That is for the PDA. That is number one.
Okay.
Number two
Okay.
is ventricular septal defect. If ventricular septal defect is sizable, okay, and patient is having symptoms because of that, certainly we have to close the VSD. So out of
Okay.
VSD, 50% of the patients will be maybe 10 to 15% can be closed with the device. Otherwise, 80 to
Okay.
85% is being closed with the surgical closure only in the operation theater. And ideal age is the age we should close the VSD. That is about ventricular septal defect. Third is ASD. ASD should be closed at the age of just before school going age. Okay, so that
Okay.
is around 4 to 5 years. Okay.
So,
Ah,
once the surgery or the procedure has been done, either by open surgery or the device closure method,
yes.
post-operative care, what would be the ideal post-operative care for these cases? Like,
Okay.
for
So
how
I
much,
think
for how many time, or days or months a kid is advised to stay at home, do bed rest, or maybe change in the eating habits or whatsoever? What would be the post-operative care regarding these?
so. Number one, this myth has to be clear. Like most of the congenital heart disease, the child is abnormal all his life. Okay. So
Uh-huh.
I would say, with my experience and with all the confidence, in 90% of the congenital heart disease, if treated properly at the right age, these child behave absolutely normally. Their life expectancy is like in sync with the normal child.
Mm-hmm.
Their eating habits, their physical abilities, their sporting habits, they're all like normal children. Okay.
Okay.
So especially these three diseases right now we are talking like PDA, VSD, ASD. These are the diseases, these are the kids. If we treat them at the right time, these kids have got perfect life all their life. Okay. They have got
Okay.
normal life expectancy. Okay. Number one. Number two, they don't need much of the post-operative care. Like if they are being done with the device closer, most of these kids are absolutely normal after 2 days of the hospital stay. Once they go home after 7 days, they can start their normal, playing normal, going to the school and everything.
Mm-hmm.
In relation with the surgery, if we close these holes with the surgery, around 1 month of the isolation and 1 month of the restriction of the activity is required because there are little chance of infection, and after that the child can have the normal life, absolutely normal life. They can go to school, they can interact with their friends, they can have the normal playing this thing in the fields, sports, everything. So these childs can behave normally after 1 month.
Is there any specific instruction or kind of advice you would like to suggest or give to people, to understand this thing better?
Yeah. So I think already mentioned in the previous episodes also, we need to understand these are the diseases. We have to, most of the 99% of these congenital heart diseases are treatable. That is number one. Number two, around 90% of the diseases, if treated at the right time, the child can have a normal life. Okay, that is number two. Number three is about myth is about the timing. Okay, see, most of the people, or even most of the doctors, even pediatric doctors, they try to explain to the parents that child is very small. Let him be, grown up little bit. So in the 50% of the congenital heart disease child, the main problem is child is not gaining weight. Okay, so
Right.
you can't wait.
Of
So
course.
child has to be intervened, child has to be treated, child has to be operated at the right age. Then only, because after some of the diseases in which child is inoperable after 1 year of the age. So it is like all with all the diseases, they have got separate ages. After that duration, child will become inoperable. Okay, and that is a pity. Okay, so the parents and the doctors has to understand child has to be operated at a certain time, then
All
only
right.
they can have the best results, then only the child will have a normal life. Okay.
All right, sir. All
Right.
right, sir. Thank you. Thank you so
Okay.
much for your time and
Yeah.
covering
First
all
of
the
all,
points that we
okay.
really wanted to
Okay.
discuss about. All
Right,
right, sir.
Shri.
Thank you.
Okay, bye
And
bye.
stay tuned for, hi guys, this was Dr. Dinesh Mittal, and we had a session regarding pediatric health, pediatric cardiac health. And stay tuned for any further updates. We'll be continuing the sessions with doctors. All right, bye. Bye, sir.
Okay, bye bye. Bye bye. Bye, Shri.